Chemotherapy. Experimental mesothelioma chemotherapy. Chemotherapy is a sort of drug that kills speedy growing cells, including most cancer cells. It smiles the same old remedy for inoperable pleural mesothelioma. In popular mesothelioma chemotherapy includes pemetrexed, cisplatin, or carboplatin. Regardless of its standard repute, chemotherapy has not been related to the first-rate mesothelioma prognosis, but researchers are investigating new ways to administer chemotherapy. In early trials, experimental chemotherapy treatments have definitely impacted some sufferers. Pressurized intraperitoneal aerosol chemotherapy. Pressurized intraperitoneal aerosol chemotherapy uses stress to enhance chemotherapy. The drug is suspended in very small droplets surrounded by way of gas. A physician can launch this pressurized chemotherapy containing fuel, spraying it on tumor tissue. Study shows this method increases the amount of chemotherapy drug in tumor tissue. However, it does no longer increase chemotherapy tiers within the bloodstream. This will suggest PIPAC sufferers will revel in fewer facet outcomes than with systemic remedy. Experimental PIPAC. Have a look at 1. Observe investigated PIPAC in 26 mesothelioma sufferers. All take a look at sufferers had a prognosis of inoperable peritoneal mesothelioma. Sufferers received PIPAC remedy and systemic chemotherapy. After remedy, 58% of sufferers became eligible for cytoreductive surgery and HIPEC. Patients who have become eligible for surgical treatment had a mean progression-free survival of 33.5 months. This means they lived nearly 3 years after the remedy and did not use proof of a cancer boom. PIPAC studies for mesothelioma is ongoing within the shape of the MESOTIP medical trial. Sticky chemotherapy or chemotherapy glue. One specific method to improving chemotherapy entails making it sticky. Individuals would possibly consider this era as chemotherapy glue. Researchers mixed a herbal glue called fibrin with chemotherapy. Fibrin is the biological glue liable for forming scabs. This mixture lets in docs to use a chemotherapy containing glue to tumors. Although it is able to sound odd, this approach gives wonderful advantages. Lets an oncologist to use excessive attention of chemotherapy at once to tumors. May not disclose the relaxation of the patient's body to the focused chemotherapy. Might also appreciably extend remedy time by physically adhering chemotherapy to tumors. An early observe of this generation in gastric most cancers sufferers mentioned encouraging results. Chemotherapy glue sufferers survived about 7 months longer than those treated with HIPEC. Researchers have also investigated chemotherapy glue in pleural mesothelioma. Patients received cisplatin-containing fibrin glue after surgical operation. Docs carried out the glue to the rims of surgically eliminated tissue. That is where microscopic tumor cells may be left behind. Have a look at mentioned a median time to recurrence of 8 months. Sufferers additionally had a mean survival of 21 months. In step with researchers, further investigation of fibrin cisplatin chemotherapy glue for pleural mesothelioma is ongoing.